So today we'll be speaking about the yellow fever virus. So the disease of the yellow fever virus is yellow fever, and then the causative agent is flavivirus fibricus. So identifying the characteristics of the causative agent. The causative agent includes an envelope, which includes a lipid bilayer that it takes up from the infected cell. And it enters the cell receptor by cell-mediated endocytosis. And cell-mediated endocytosis is a process in which a cell absorbs metabolites, hormones, and other proteins by inward budding of plasma membrane vesicles containing proteins with receptor sites specific to the molecules being absorbed. Now, the diagnosis for yellow fever virus, signs and symptoms are usually diagnostic, accompanied with travel history, usually when travel history includes travel to South America or countries in Africa, which we will talk about later on. In fatal cases, nucleic acid amplification, histology, and immunochemistry of virus culture, biopsy, or autopsy tissue can be positive, which will prove that the infected individual did die from yellow fever virus. And finally, testing the serum to detect virus-specific IgM and neutralizing antibodies are diagnostic in a living person to help confirm that it is yellow fever virus that is causing these problems.
Okay, so mode of transmission. Yellow fever is typically spread via vectors. These would be mosquitoes found in Sub-Saharan Africa and South America. The specific mosquitoes that typically carry the yellow fever virus are the Aedes and Haemogagus species. These are just the mosquitoes that are found in these areas most typically. And these two maps are from the CDC. The areas in yellow show where they absolutely recommend vaccination for yellow fever. If you're traveling there, if you live there, if you have anything to do with those areas, that is where those mosquitoes are found abundantly, and it's very important to prevent against it to get that vaccination.
There are a number of signs and symptoms associated with yellow fever virus. However, in the first 3 to 6 days after contracting the virus, an individual will be asymptomatic. Following those 3 to 6 days, the individual enters the acute phase, in which signs and symptoms can include fever, headache, muscle aches, sensitivity to light, nausea, vomiting, loss of appetite, dizziness, and red eyes, face, or tongue. The majority of cases of yellow fever do not progress beyond the acute phase, but those that do see an improvement of symptoms prior to the progression to the toxic phase. Approximately 15% of cases progress to the toxic phase. In the toxic phase, signs and symptoms can include abdominal pain, vomiting, bleeding from the nose, mouth, and eyes, bradycardia, and liver and kidney failure. Vomiting has also been known as black vomit due to the presence of blood, giving it a black color. Bradycardia is the slowing of the heart rate, and when the liver fails, it's no longer able to secrete bile. This causes a buildup of yellow pigments that would normally be broken down in the bile, which get absorbed into the skin and the eyes, causing the symptom known as jaundice. Functional kidneys filter waste from the blood and remove it from the body through urination. As the kidneys fail, they are no longer capable of doing this, therefore the urination decreases. This also affects other systems because the waste and toxins that would be excreted through the urine remain in the blood. The symptoms of brain dysfunction, such as delirium, seizures, and coma, can also be attributed to the failure of the kidneys in yellow fever virus. There is a mortality rate between 20 and 50% for those individuals that progress to the toxic phase. Unfortunately, there are no antiviral medications that have been proven to treat yellow fever. The only treatment available is supportive care in a hospital for managing the signs and symptoms. The supportive care can include providing fluids and oxygen, maintaining blood pressure and replacing blood loss, dialysis, and treating secondary infections. Dialysis is given to patients whose kidneys are failing. In this treatment, a machine filters the blood in place of the kidneys.
Now, modes of prevention for the yellow fever virus are similar to many other preventative measures for vector-causing viruses and diseases. So the modes of prevention include wearing protective gear, including pants, sweaters, and mesh netting, using mosquito repellent, and receiving the vaccination if you live in or are traveling to affected countries and regions where you may become infected with the virus.
Okay, virulence factors. The virulence factors for yellow fever virus are pretty legit, I would say. The entire, basically, macromolecule surface of a virus is its virulence factor. The proteins found on the flavivirus signal for binding to a host cell, entry in a host cell, invasion. The entire structure is designed to invade macrophages and just wreak havoc. So they are definitely hard to kill, hence why there's such a high mortality rate and why it's so virulent, and why we really, really need to vaccinate.
One example of a case study for yellow fever virus includes the following scenario. A 24-year-old male comes into the emergency room complaining of headaches, nausea, sensitivity to light, and muscle aches. Believing it is the flu, he is reluctant to go to the hospital. However, the redness in his eyes concerned him. After taking his temperature, it is seen to be 104 degrees Fahrenheit, and it's decided that his symptoms are concerning enough to admit him. Within several hours of his admittance, there is an improvement in his symptoms, shortly followed by noticing that his skin and eyes have yellowed. He vomits a distinct black color, and he begins to bleed from the eyes, nose, and mouth before becoming delirious. You ask him what his profession is, and he discloses that he's a photographer and has recently been in the Congo taking pictures for his magazine. The questions asked of this case study are 1. What disease is this and what is the causative agent? 2. What signs and symptoms support that diagnosis? 3. How is the disease likely transmitted to the patient? And 4. What assisted the virus in invading the cells of the patient? So for the answers, the disease is yellow fever. The causative agent is flavivirus fibricus. The signs and symptoms that support this diagnosis are the fever, headache, muscle aches, sensitivity to light, nausea, and red eyes that the patient was admitted with. Specifically, the red eyes is characteristic of yellow fever virus. And then that his symptoms progressed to show jaundice, black vomit, bleeding from the nose, mouth, and eyes, and delirium. Yellow fever gets its name from the yellow color of the jaundice of the patients in the toxic phase. The disease was likely transmitted to the patient by the vector of a mosquito bite when he was in the Congo for his work. And for what assisted the virus in invading the cells of the patient, the macromolecules on the surface of the virus and the E protein helped the virus bind to and deliver its DNA into the host cells of the patient. These are the sources from which we found our information.